Now, I would like to call upon the stage Dr. Vijay Patni sir. He is sir, just sir, just a minute. Sir has created a Diabetic Research and Welfare Society Association, which is founded on 7 September 2011. The Diabetic Research and Welfare Association began. Now is a meeting of doctors discussing clinical cases after a medical camp with 500 plus participants in Kolkata. Since then, the organization has been conducting regular monthly CME programs, and in April 2013, the association successfully organized its first annual conferences at Diamond Hut Harbour, marking as an important milestone. And talking about the milestone, to promote diabetic awareness, education and research and help live with people better life. And what is the objectives? So basically academic monthly CME programs and platform for young doctors, social screening, camps, patient education and community incentives. Research has done encouraging research in the field of diabetes. Sir, please say some few words.
Thank you. Good evening, everyone. So I'm from DRWA, and I thank Dr. Ashutosh Mishra sir for giving this opportunity and also giving a good topic, I would say. So what we are going to discuss is an important topic, a practical one, and we have a team of four. We have a team of four. Dr. M.S. Sanwarwala, who happens to be the president of DRWA, Dr. Sandeep Mandal, Dr. Tamnash Bhattacharya, who is the present president-elect, and Dr. Shambhu Samazdar. So all four of us are going to take you through this particular journey on the topic. The topic given is a pragmatic CKM-ready diabetes care, the blueprint for a busy physician. So basically, it's a very practical topic where we are going to discuss how in a clinic, present day clinic, the CKM axis can be taken care of. So before we start, actually, I'll just give a small intro on this. What we need to understand that we have to move beyond HbA1c. That is what the crux of the whole symposia or the whole theme of this particular conference is. And for doing that, we need to understand that since 2015, we have moved about. We were glucocentric, now we have a holistic approach towards the management of people living with diabetes. So what we need to do is extremely important that first and foremost, we have to have a unified risk stratification. No, you go there. So first and foremost, unified risk stratification is extremely important where you can integrate the whole axis, CKM axis, while planning out the risk of that individual. So what is more important, now you have to add UACR and EGFR also as an important matrix along with blood pressure. So you have to include that as an important matrix. So you have to stratify the risk based on that. Number two is what is important is now the evidence-based pillar therapy, what we know. We actually heard, Dr. Akash Singh was talking about CKM axis heart failure and what the evidence is. So that is what we need to understand, that the therapy has to be incorporating all the pillars so that we can get the best outcome out of this CKM management. And the third one is, if you are in a clinic, in a busy clinic, you have to understand that you have to have a proper operational clinic in order to manage this. So in considering that, first and foremost, you have to delegate your staff. You have to tutor them as well. You have to have your own EHR or EMR so that you can integrate all the tests which are required in this group of patients. So that is very important that you have a holistic approach to the patient. So that is also important for any clinic now. So though it is a busy clinic, but if you have everything as per properly arranged, then probably you will be able to manage it. And most important is whenever you are considering management, you have to have a patient-centered, pragmatic approach. So you have to take the patient into the mode of management tool. That means you have to have the consent. You need to specify, you need to address the patient, concerns and needs. Along with that, always take him into confidence while planning out any management for that individual. So patient-centered has to be there while managing. So the last part, what I would say, all this considering that when you are trying to manage a CKM, so there are two integral part of this, as I said. One is the pillar therapy, that is the pharmacological therapy, and the other part is the non-pharmacological, where lifestyle is very important. I just want to incorporate, because someone said it's today is the International Sleep Day. So you need to manage the sleep properly. So you have to have about 6 to 8 hours of reasonable sleep, along with obviously diet and exercise as an important lifestyle tool. So here you have to make those necessary changes considering the patient's phenotype, and you have to go along with it. So now I'm coming to the program per se.